as you may or may not know, it's me, Smile McGee, and this week's vlog, I've been trying to decide how in the heck to do it. So I was gonna do it after my breast ultrasound, but then we had to wait for the surgeon to call back because the ultrasound showed findings we didn't expect. And then I was gonna do it after my immunology appointment, but I was just way too tired and had other stuff that took priority. So this got thrown to the back burner, and then I was going to do this yesterday, but then I remembered I have my appointment with the surgeon who did my scope today to talk about my stomach issues, you know, the scope I had when I was in the hospital. Yeah, to talk about my stomach issues, so I thought, why not just mush it all together into one big medically complicated vlog. And since you can hear and already know my life is a train wreck, that is exactly what I'm gonna do. So here is a big old vlog talking all about my breast ultrasounds and the crazy findings with that, my immunology appointment, and today's appointment with the surgeon. Here is a little rewind on the story thus far. Get my ultrasound, and I'm way too big for the gown, so that makes it even more comfortable. So basically, when I've been getting scans for like all my cancer scans and stuff, they've seen tumors just apparently flaring through it in my left breast. So getting those ultrasounded today to make sure they're okay, and the MRI to show what Bundy is actually showed that there's a third tumor in my breast. We only knew about 2 of them, and apparently one of the 2 has grown, so I just have to make sure they don't need to be removed again, because having cancer in the past puts you at a higher risk, and apparently I have some sort of tumor growing disorder, so that's fun. But anyway, I'm guessing just a little ultrasound here today, maybe a mammo, and hopefully no surgery. But if I do, the surgeon's really, really good. And it wasn't the worst surgery in the whole world, so it'll be just fine. Yeah, it'll be just fine. I was trying to keep my cool, but as you guys could probably see, I was a nervous wreck. I came to the hospital full of candy canes in my backpack and anxiety in my heart, because during that scan we discovered that 2 tumors we had known about had grown longer, and there was a brand new tumor in my breast, like the MRI said. The radiologist wouldn't spill the beans about the margins or anything. She just kept on asking vague, intimidating questions and told me for any results I would have to wait for my surgeon to call me back. I just realized I've been rocking a hospital bracelet all day. Talk about spoony swag. Lungs and life are kind of kicking my butt today. I've just spent the day like sleeping and writing. But good news is I got a call from my surgeon this morning. I guess it's just kind of neutral news really. But so it does show 3 tumors, which I knew, and the other 2 tumors have grown. But she's not like thinking it's immediate to do surgeries or biopsies right now, and wants to scan again in 6 months, which means I will most likely go through the whole year of 2019 without a surgery, so woo! I'm really excited about that fact. One more freaking doctor's appointment tomorrow, and bearing that this is actually like really bad pneumonia, I should be done for the rest of the year. Hallelujah freaking Luya. Okay, in retrospect, I should have asked the surgeon's nurse a lot more questions, but I was just really stoked I wasn't going to have a surgery in 2019. These tumors still could not be something awesome. Them growing longer doesn't seem really awesome, so I'm not sure if I should question that off as more, but I'll take as much good news as I can get. Again, this is a Squampus vlog, so we're going into my next appointment this week, which was my immunology appointment. Here you go. So this vlog's a little squampus, but I just got done with my immunology appointment and it was really, really good. So this one was just kind of a follow-up, see what's going on. Please, we're trying to find Walmart. But it was just kind of see if I produce adequate antibodies and need IVIG, or just kind of what we need to do. And he believes like my immune globulin level is really, really low, but he thinks a combination of my autoimmune disease and my prednisone are killing my antibodies. Like, I make an appropriate antibody, it just gets killed off, which is like totally typical autoimmune. So he's doing something really nice, and he's giving me a refillable prescription of doxycycline, which is a pretty strong antibiotic. So when I have infections like what I have right now, I can just have antibiotics on hand. And since there was that thing in my CT that was either an autoimmune thing or infection, he just wants to be safe and make sure it's not pneumonia because I'm at a higher risk for it. So he's having me start a doxycycline dose right now. And I asked him about follow-ups because I thought it was going to be a normal, well, it's a secondary thing, good luck kid, try not to die. And he wants to see me actually every 3 to 6 months to make sure my immune globulin stays okay. And just make sure I'm doing okay. Like, he was awesome. It was a really good appointment. And he wants to see if I'm still allergic to amoxicillin. Because when I was little, it affected my central nervous system and made me like nuts. But apparently you can grow out of it. So he's going to have me do this special sort of skin test where you see if I'm still allergic. I have to chill there like all day. But it'll be really nice to know if I'm still allergic to it or not. Really awesome doctor. Handed out candy canes to like the whole office, which is super fun. So I'm just really happy it was a really successful appointment. Both are so nice. Blame the brain fog. Here's the part I forgot. I think this is what I was trying to remember, but I'm not sure. Probably write this in my post today anyway, but I'll have it on here too. The doctors think my lungs right now may possibly have pneumonia. It has this thing called ground glass in it, which is like, I don't know, it's hard to explain. But it's either a sign of infection or inflammation. So he thinks my autoimmune disease might be causing it, or it might be slight pneumonia. So he wants me to start the doxycycline right now to be safe. And he's like, you get any sicker, get help like immediately. And then he asks me to have doxycycline whenever I get sick. So that's really, really nice.
This way.
Our general surgeon in town is the best. He is a good family friend, and we went into the appointment, and I told him, like, he was wanting to go over my medication list and stuff, and I told him, since taking care of it from the hospital, the pain is pretty much gone in my stomach. He's like, well, do you have a long-term prescription for Carafate? I'm like, no, I didn't know that was a thing. He's like, here, let me give you one. So he thinks the Carafate should protect my stomach from all the treatments that are keeping me alive, and just even help with the damage my disease is doing to my stomach. So, yay, I felt so much better on Carafate, and now I just get to stay on it. It can have some drug interactions, so I have to talk with our pharmacist about that, but again, best pharmacist ever. So I am so happy. Hopefully my last doctor's appointment of the year, and I am just so happy because I feel like I'm going to be feeling better. Get rid of this little tinge of pneumonia, and it's uphill from here. Let's end the vlog on this high note. So there is all the crazy medical that's happened this week. So far, the new tumors aren't cancerous, but we will see in 6 months. And I guess in January, we'll see how that leg tumor is doing. And I will forever be a tumor factory, so I just have to learn how to deal with that. My disease is destroying my immune system, but I have an immunologist who is very caring and is going to help me through that. And the second things get way wonky, he will give me whatever, he'll just do whatever in his power to help me, which is really, really nice. And then my stomach is going to be saved by our amazing local general surgeon and Carafate. Merry Christmas to me. Jeez. Oh, and I have a tinge of pneumonia.
but it's all good in the hood. It's either pneumonia or infection, but it's feeling like pneumonia. Anyway, Merry Christmas to me. Life is good. Happy freaking holidays. No more doctors. Enjoy it. Enjoy this life you've been given. Take every little victory and always smile on.